Hello, and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County League of Women Voters, one of the civic partners for our show. My guest today is Tammy Hayes. She's the Director of Patient Services with Hospice of the St. Lawrence Valley. We're going to explore a rather difficult topic today: when to call in hospice, how to define the end of life. Tammy, welcome to North Country Matters. This is the third in our series of shows about the services that hospice provides. So let's start out by asking you to tell us a little bit about yourself and what brought you to this kind of work for hospice.
Okay, well, I've been a nurse for about 12 years. So this is like my third career, so to speak. I've always had an affinity for the older folks. I love hearing their stories and, just how things were different when they were little and things like that, because, as things have changed over the years in many, many, many ways. So I just enjoyed it. And then when my parents passed, just kind of looking at that, seeing what I thought could have been better, for them kind of thing. So yeah, that's kind of where I'm here. I like to help people. I love this job. It's absolutely amazing.
Well, everybody that I talk to who works for hospice calls it something that they love and they feel so committed to. It's a real calling, isn't it?
It is. It absolutely is. When I started out, I worked in a nursing home. And then my next job after that was hospice. And I only left briefly when I moved up here for a couple of years, and then a position opened and I came back. So
Well, I know they appreciate having you. So you actually wear a number of hats for hospice. Tell us a little bit about the
I do.
programs and services that you oversee.
Okay, so as the director of patient services, I not only oversee the nurses and the home health aides, I oversee our social workers, our spiritual care person, and our volunteer coordinator. So it's quite a bit of staff and things that we do. Our nurses go out daily to see their different patients, minimum of once a week. The nurse will see their patients. Um, Home health aides can be anywhere from 1 day a week to 7, depending on the need of the patient and the family. Our social workers are out there 1 to 2 times a month, as are our spiritual care personnel. Um, and all those visits can be increased if needed. It all depends on what the needs of the patient and the family are. We are available 24 hours a day as far as being reached by phone. We can also make a visit in the middle of the night, 3 o'clock in the morning. There's something going on. A nurse can be sent out. Social workers will follow up the next day if there's a social work need. So we work as a team. We definitely work as a team, including everybody out there, trying to get everybody in the home just to provide the families and the patient with any and all services that they need.
So this is so much of a patient-centered operation that you have there that it
Absolutely.
is all based on individual need, isn't it?
It is, yes. I mean, what we give to one patient can look completely different than what another patient gets, but all services are available to everybody. So it just depends on what the family and patient are comfortable with.
Sure. So how and when is a referral to hospice made? Can you kind of describe a typical process for us so folks will get a sense of what they should be thinking about when it's time to
Mm-hmm.
call?
So I think the best time to call is if you or your family member have been into the hospital, in and out of the hospital many times in, say, the last couple of months, and that's just not where you want to be. You'd rather spend your time at home. And if you're going in for symptom control, say you have COPD and you're having a lot of breathing issues, so you go into the hospital, they fix it, so to speak, and then they send you home. And then you have the symptoms again and you go back. So if you're sick of being in the hospital all the time, we can help control those symptoms at home. We can get those medications for you. We can, our nurses do a physical assessment. They check you from head to toe every time they're in the home. So, there's that type of referral where, somebody is in and out of the hospital frequently. There are those that, maybe they have cancer and they're not happy with the side effects of the chemo or the radiation. And they're just saying, I don't want to do it anymore. I don't feel like I can live fully. I'm in bed sick all the time. So they want to stop the chemo and or the radiation. So that would be another time to call us when you're done seeking treatments. And it's as simple as picking up the phone and calling the office. You would speak to either Amanda, who is our admissions coordinator, or myself if she's out. We reach out, we get the medical records for you, send them to our doctors who review and say, yep, you meet, and then we call you up and say, okay, we've got the approval, let's get you scheduled for an admission. And those admissions generally happen within 1 to 2 days of getting the referral in. So it's pretty quick turnover.
When you were describing the person who's in and out of the hospital, that really describes my dad towards the end of his life. He was definitely a frequent flyer to the emergency room.
Yes.
And we did call hospice, and at that time the determination was made that perhaps the advanced illness management would be a better option for him. So they kind of switched us over to that. So that's really nice that you folks can really make those assessments and then decide what the next best step is. That's really important. And it's the sort of thing that it's hard for families to really understand what is happening. And so why don't you give us some of the general indications of decline, which demonstrate that it's the appropriate time to start having this conversation about hospice, not only with hospice, but with other family members and with the person, because it has to be a decision that has come to by everybody in the process, doesn't it?
Well, honestly, yes, but the patient, if they're alert and oriented, they are the ones that ultimately make the decision. So even if the family says, this is something that we really want, the patient can say no. But again, you're looking at, are they starting to eat less? Are they in and out of the hospital a lot? Are they spending more time at the hospital than they're spending at home? Things like that. Are they having a harder time getting out of the home? Are they just not wanting to go out of the home as much? Are they having you come to them more often than not? Things like that. So, and honestly, this discussion should happen before you see these signs, honestly. So whenever, if your parents bring up, oh, so-and-so died, so you can start the conversation by saying, oh, well, what would you want when when it's your time? What kind of services do you want? Do you want to be in the hospital? Do you want to be at home? And if they say, I want to be at home, then you can say, okay, well, I've heard of hospice. Is this something that you might like? I am more than willing to come out and speak with families at any time in a disease process, even if it's just to say, hey, this is what we can offer you when the time is right for you. And it is quite a bit of services that we can offer. Like I talked about with our staff already, but we also offer medical equipment. We pay for some of the medications. We can, if there's any wounds or anything like that, we manage those as well. So there's no more trips to, say, maybe the wound center, things like that. So the conversations should start as early as possible. But if you see your loved one, again, in and out of the hospital a lot, not eating maybe as much as they once did, losing some weight, that kind of thing.
So you've given us some good tips there about kind of how to start the conversation, particularly with the patient. How do you include the larger family in these conversations? Because of course, if the person has a spouse, that's one thing, but there may also be adult children who are in the area and also want to be able to help, but may not know how to use the hospice services most effectively. So how can hospice be supportive of the larger family during this process?
For the referral process, a lot of times I've had, adult children that live outside of the area on the phone for the informational so that they can then ask the questions that they have and kind of understand from their perspective, what's going on, how we do what we do. We talk about FMLA, Family Medical Leave Act. We're more than happy to help you fill out that paperwork, have our physicians sign it, things like that. So we are proactive with the entire family, seeing what their needs are, letting them know, where the patient is at, what type of care they're needing, and seeing if there's more than one sibling involved, can you guys rotate, some big time off from work, rotate through so that, you're not losing a ton of work time, but your parents are still cared for, or your loved one, whoever it may be.
Yes, and that can often be fall to be such a burden on one person if there aren't
Yeah,
more people to help with. And we all know that caregiving is a very rewarding but a very difficult task.
it
So
is.
having an organization like Hospice to help with that process and to give suggestions and ideas about how to be effective is so important. Well, we all know that, as the old phrase goes, denial is not a river in Egypt. So while the hospice may be indicated, not everybody's always on board with that decision at the same time. How can hospice help get uh, people in the same room and talking about the same thing in a way that is going to be most effective for the patient?
Um, like I said, again, the informationals, just talking to them, giving them some very real answers as far as where their loved one is in the disease process. Sometimes the doctors at the hospital, their goal is to make people better. That's what you go into the hospital for, is to get better generally. But we all get to that point in life where we're just not going to get better. As the famous saying, none of us are getting out of this alive. We're not, we are all going to die at some point. So, just giving them some real information about what the, medical reports have said, what we're seeing with the patient, explaining that what they're seeing is the declines that are happening with that loved one. And just letting them know that it's a normal part of life, that it's okay. And that, if they opt to have us come into the home, we are here to help them and to guide them through that process and to educate them so that they understand what's going on.
You make a very good point there about how we have all been socialized to think that modern medicine is always going to work a miracle, and that once we're under a doctor's care, we'll be able to fix whatever's wrong and go back to whatever our normal activities were. But as
Right.
you point out, that picture is not reality. What are some ideas for starting the end of life conversation with medical professionals? Because advocacy for the, excuse me, for the patient and from the patient and the family is really important in this process, isn't it?
It is, absolutely. So it's up to the patient and or their family members to say to the doctor, look, we've been seeing these declines. Is there something that can help us in the home? Is there a program that can help us? Or if you've heard of us, hey, what about hospice? Or what about the palliative care AIM program? Is that something that would be beneficial to myself or my loved one? So just, knowing that we're here, that we can provide some services for you, and just asking about it, because as we age, our parents, our loved ones, they know where they are in life. They know that the end is coming. Um, and it's hard to accept. My husband himself, he, said the same thing when we had a conversation the other day. I don't want to talk about this with his parents, but it does happen. It's, inevitable. So, just trying to say, I think I'm at this point, or I want to explore something different. I don't want to be in the hospital all the time. I don't want to be going out just to doctor's appointments all the time. I want to be able to go out and have lunch with my friends instead of, coming to see you, doc? How can I make that happen? That kind of thing. Um, because as we age, it does get harder to get out. So those outings need to be more meaningful than just a doctor's appointment kind of, you know, outing.
Yeah, that's for sure. I think of the last few days in my dad's life, and he was clearly ready to go. And
Mhm.
he said to my sister and I, who were with him, don't worry about us. Your mother and I will be fine. You girls go on and get on with whatever it is that you need to do with your
Mhm.
life, because we had, of course, been devoting a lot of time and energy to their
Mhm.
care. And that was about 24 hours before he died. But he was very upbeat and he was ready. And, in one way that made it a little easier for us because we knew he was accepting where he was and the fight was over. So for
Right.
him, and he was
Yes.
perfectly okay with that. So I think that did
Yeah.
bring a lot of comfort to all of us to think that after a good long life, he was ready to go. So
Yep, it does. And, starting those conversations as early as possible. I mean, from my own experience, my parents came home one night when I was about 16 and they were like, oh, hey, we just did our wills. This is what's going to happen. Now, I admit at 16, I did not want to hear it. But they did bring it up over the years. So when the time came, I knew what his wishes were, what my mother's wishes were, and it made that process, I don't want to say easier, but I knew that the decisions was making were based upon his wishes. So it made it easier to go forward with his wishes, whatever the medical wishes were. So again, just bringing it up, you know, if you see something about hospice, just bring it up and say, hey, I saw this podcast about hospice, or, they were out at a health fair. What do you think about it? Just, or again, like I said earlier, somebody dies and, your parents are talking about their obituary, hey, have you thought about what you want? What can I do to help make, you know, your life at the end easier? That kind of thing.
yeah, and that's very true. My parents had done the same thing about 40 years before they died. They had done their wills and gotten everything organized. About 30 years, they had gone and got a cemetery plot. And it felt like really early,
Mm-hmm.
obviously, because they had
Right.
another 30 years to go. But in one sense, at the time, it made it much easier because we didn't have to scramble to figure out what it
Right.
was they wanted to do. And for older folks who have done that kind of planning and thinking, bringing up those topics with their own family members is actually a lot of comfort for folks, even though they may be, I don't really want to talk about this, but we need to.
Right. You do. You need to talk about it. And it doesn't make the emotional part of it easier, but like you said, you're not scrambling to find, a burial plot or try to figure out what they might want for their funeral services or the wake or something like that. So if it's all in place, it takes a lot off your um, family members that are going to be left behind.
That's right, because as you say, you're dealing with the emotional loss at the
Mhm.
same time that you're having to make some very practical decisions. And having those decisions thought about ahead of time makes it a little easier to get through the emotional loss because you're not torn with all of these other things that all of a sudden
Absolutely.
have cropped up. So, Tammy, as we start to conclude here, what final thoughts do you have for folks? Because you certainly see this every day. You have a lot of experience and you've seen what works for folks when it
Mhm.
comes to hospice and, making the end of life as peaceful as we can possibly make it. So give us your thoughts.
I think the earlier you call, the better. Again, even if it's just for some information, even if you feel that you're not ready for hospice, but it's something you want to utilize later on, call for that informational. Get that information in place, let your children know, um, and be aware of what we have to offer. It truly is a lot that we can offer, that we can bring into the home. Um, the families, we have an overwhelming response that, our services are wonderful. Um, the nurses go above and beyond, as do the rest of our staff, for the patients. Um, will take the time to explain it. There is always somebody, if you can't get a hold of your specific nurse, you can get a hold of myself or a couple other nurses here in the office. We can certainly take care of you. So again, just call as soon as possible. The longer we're in the home, the better it is, and the better quality of life you or your loved one will have.
And that really is the secret to a peaceful passing, isn't it? And the other thing I
Yeah.
know that hospice is so great about is even if the family needs services that you don't offer, you have a great relationship with other types of providers like the Office of the Aging. You can offer a
Absolutely.
lot of that kind of informational stuff that people might not know if this is the first time they're going through it. They don't really know what the
Right.
resources out there are. So I think that's another very valuable service that hospice provides, which is just connecting you with other service providers when it's
Yeah.
needed.
Absolutely. And we'll let you know if you're not sure if you're ready for us. We can take a look at your health history and let you know if you meet criteria or not. And if you don't, we will suggest our AIM program for the palliative care. And if you do opt for palliative care, they will let you know when it's time to transfer over to us. And it's a very smooth transition from one program to the other. Or, if somebody stabilizes and needs to come off of hospice, we can smoothly transition over into the AIM program. So
Well,
lots of good connections.
that's very comforting to know, and I hope that people will take advantage of this opportunity to make that phone call because you may not need it now, but the more homework you do ahead of time, the easier it is going to be when that time comes,
Right.
isn't it? So
It is, absolutely.
that's the beauty of the hospice program is that it's there for support and information before you need it. And then when you do need it,
Mhm.
you're all set to offer exactly whatever is uh, needed. And so thank you, Tammy, so much for the work that you do and the work that your colleagues in hospice do because they provide a tremendous service. And anybody who's ever had a hospice service knows exactly how valuable it is and knows what a gift it has been to have that burden shared. It won't be lifted, but it will be shared,
Well,
and that's important.
definitely sure. Well, thank you for helping to get our name out there. We really appreciate it.
Well, it's a great service, and as I say, this is the third in a series. We're going to be continuing it after
Mhm.
the first of the year, so more of your colleagues will have some opportunities to talk about hospice, what it does, and how it helps. So thank you so
Wonderful.
much for coming
Wonderful.
in today.
Thank you.
All right. These conversations are a production of North Country Matters. This show is a civic collaboration between the League of Women Voters of St. Lawrence County and the Potsdam Public Library. Until next time, remember, our North Country matters.